All right, now the reason why we want to avoid these exercises has to do with the relationship between your deltoids and your rotator cuff muscles. All right, we can also throw in your upper traps and your pecs as well, because those three muscles, okay, the deltoids, upper traps, and pecs, they dominate your rotator cuff muscles when we do a lot of our shoulder exercises, okay? And that's if our rotator cuff muscles are weak, which if you have shoulder pain, you likely have some weakness in your rotator cuff muscles, okay? Because that's usually the start of shoulder pain. Now, what happens between the deltoid and the rotator cuff muscles is when we do our movement, when we're doing our overhead exercises, we want that head of the humerus to stay inside that glenoid fossa. When we do this movement here, as the deltoid is pulling the head of the humerus upward, okay? So if we get weakness in the rotator cuff muscles, they're going to be unable to keep that head of the humerus inside that glenoid fossa, and the deltoid is going to pull it upwards. We're going to get that impingement in between the AC joint and the head of the humerus. That's when we're going to start having shoulder problems, and they're just going to keep compounding, okay? So if we try to strengthen our deltoids, if we try to strengthen our upper traps and pecs, we're going to be left with more muscle imbalance, all right? So we need to avoid these exercises. We need to work on releasing tension in our upper traps, our deltoids, our pecs, and we need to work on strengthening our rotator cuff muscles. So internal, external rotation for rotator cuff muscles. We need to work on strengthening our middle traps or lower traps and rhomboids, as well as the serratus anterior, so this muscle back in here to help with scapular stability, okay? Because we need to increase the scapular stability. We need to increase shoulder stability before we worry about our traps, before we worry about our deltoids, before we worry about our pecs, all right? That's why.